Ovulation begins each cycle. Hormones mature follicles in the ovaries as the uterus prepares a lush lining. A dominant follicle swells. Rising LH triggers final maturation of the egg inside. Ovulation. The follicle releases the ovum from the ovary surface into the pelvic cavity. Fimbriae sweep the ovum into the fallopian tube. Cilia gently carry it toward the uterus. Estrogen and progesterone coordinate timing, thickening cervical mucus to help or hinder sperm. Inside the tube, the ovum remains viable for about 12 to 24 hours awaiting sperm. After ejaculation, millions of sperm enter the cervix. Most never pass the uterus. Only motile, healthy sperm navigate mucus and immune defenses toward the tubes. Chemical signals guide sperm to the ovum. Capacitation readies them to penetrate the egg coat. Only the strongest reach the egg. At the tube's opening, currents funnel sperm toward the waiting ovum. One hero sperm binds the zona pellucida and begins the acrosome reaction. Enzymes digest a path through the zona while the ovum completes meiosis. Membranes fuse. The sperm head enters, delivering paternal DNA. A cortical reaction hardens the zona, blocking all other sperm. Polyspermy prevented. Maternal and paternal chromosomes pair to form a unique genetic blueprint, zygote. Pronuclei merge. First cell divisions are powered by the ovum's stored energy. Cleavage continues. 2 cells become 4, then 8, with no increase in size. By day 3, a compacting morula forms, cells specializing in fate. A fluid-filled blastocyst appears. Inner cell mass will become the embryo. The blastocyst drifts toward the uterus, timed with peak endometrial receptivity. Implantation begins. The blastocyst aligns and opposes the receptive endometrium. Trophoblast cells invade gently, anchoring the conceptus and starting the placenta. Maternal and embryonic vessels connect. HCG maintains progesterone to support pregnancy. This marks the beginning of pregnancy. Embryo supported by a forming placenta. Early weeks, neural tube and heart form. The placenta grows to nourish and protect. By week 8, organs are outlined. Blood flow synchronizes with rapid growth. If fertilization does not occur, the ovum simply degenerates. Hormone levels fall, signaling that the cycle will reset. Vessels constrict, and the endometrium breaks down. Prelude to menstruation. Menstruation sheds the uterine lining, normal, cyclical, and healthy. Bleeding tapers as hormones rise to start follicle growth again. Across cycles, ovulation enables potential fertilization and pregnancy. When conception occurs, the cycle shifts to pregnancy, not menstruation. Ovulation, fertilization, menstruation. A coordinated repeating physiology. First trimester, implantation completes, placenta forms, heartbeat appears by week 6. Second trimester, organs refine, limbs move, and fetal sex can be identified. Third trimester, rapid brain growth, lung maturation, baby gains fat and turns head down. Labor begins when hormones trigger contractions. The cervix dilates to about 10 centimeters. Delivery. Baby is born through the birth canal, followed by the placenta, completing childbirth. This 3D video is AI generated for educational purposes only. Always consult healthcare professionals for medical guidance.